Qualcast Nation, listen, we have a very special guest today. I am truly honored to have Dr. Rena Malik on the show. She has been an absolute revolutionary physician advocate when it comes to women's health, sexual health. You've seen her everywhere. It's a true privilege to have you on, Rena. Thank you so much for joining us.
Thanks so much for having me.
Absolutely. So we are talking about sexual health in a perimenopausal population. And I guess one of the things I wanted to get from you was, how big of an issue is this? You know, I know we've really, especially on our show, we've tried to put an emphasis on how much we've underserved this population when it comes to their general symptoms and so forth. But from the sexual health side, how big of a problem are we talking about?
Yeah, it's actually quite big. So if you look at data on, looking at people taking what's called a female sexual function index, which tells you how many women fall into the category of sexual dysfunction when they answer these questions based on arousal, desire, satisfaction, pain, all the different sort of areas of sexual health. About 40% of people score high enough to have sexual dysfunction. Now, what is really important, though, is while it's very, very common to have some issue, most commonly low desire, it is only bothersome to about 12%. Now, that's still a big number, but it's not everybody. So some people may have dysfunction in this area, but they're not bothered. And then if you're not bothered, that's fine. But if you are bothered, I think that's really important to understand that there is help available. Like, you don't have to live like this, and you absolutely can get your sex life to where you want it to be. So you're having pain-free, pleasurable, enjoyable sex that's worth having, that's worth desiring, and that really makes you feel like yourself again. If you are, if that lack of sex or those changes in your sex life have changed you, you can get back there.
Oh, man. And I feel like this is going to be music to the ears of so many folks. So what are some of the aspects that in terms of symptoms or concerns for women? Like I know, for example, desire might be something that needs to be dealt with. Pain might be something that needs to be dealt with. Yeah. So what at a high level, like, what are kind of the concerns that you have to address with many of your patients?
Yeah, so I think you addressed the most common ones, which are desire and pain, right? Of course, if you're having any pain or discomfort with sex, you absolutely should. That's not normal. That's not something you drink a glass of wine with and just ignore. It should not be painful. And then, certainly changes in lubrication are common as you're going through perimenopause. Changes in arousal. So feeling that, that pelvic fullness, that excitement that comes with being turned on. And then also changes in orgasm. So oftentimes we'll see women who will say that my orgasm has gotten less strong, or I can't have an orgasm anymore. It just takes a lot more work to get there. And so overall, and then just generally feeling like, you're not enjoying sex as you used to, which is sort of like a vague thing. But I think sometimes you're like, hey, I used to really love it. And now, like, yeah, we have sex, we have enough. I still want it. So, but I just don't enjoy it as much, right? So like maybe digging back on why that is. And so I think those are all reasons to see someone. And I think the really important take home is that any problem with sex is biopsychosocial, meaning that yes, there could be something physiologically that is wrong that is causing this, like changes in hormones very commonly cause a lot of issues. There also is a psychological concern, right? Because anytime you have a problem in the bedroom, it stays with you, right? Mm-hmm. You one time have a problem where maybe you didn't orgasm like you wanted to, or, you really didn't like sex. And the next time you're like, am I going to climax? Is it going to happen for me? You're thinking about that during the encounter rather than enjoying the encounter, right? And so that is with everybody. I say there's always a little bit of psychological part of it, right? And then there's a social part, right? Like, this is not just you, this is a relationship, right? And so you have to look at the whole big picture of what's going on. It's not just one little piece. And so I think the important thing is to realize when you see your doctor that they're focusing on all those things, that you may need help from a sex therapist. You may need help to talk to them about the psychological parts of it, right? And you may need relationship help if that's part of it. You may need to bring your partner into the sex therapy session, or you may need to go to couples therapy. But I think ultimately realizing that it's not just you individually by yourself. And, there are so many things that are available to help you, and you're worth it. You're worth for fighting for having great sex, right? That's important.
You live once, right?
Yeah.
I gotta say too, it's I'm glad you bring this up, the psychosocial aspect, because there's obviously going to be some components within perimenopausal that are of concern. But if you think about this population, your midlife, your mid-career, you're taking care of your own family, you're maybe even taking care of your parents, as an example. There's so many balls in the air that you're trying to keep afloat. I mix metaphors all the time. I don't even know if that works, but but you know what I mean. That aspect of things, I think, is a very important one. And so, I mean, I think it also ties to desire. We talked about this several parts, but I'm wondering if there's any I guess tips or tricks that you think that would be worth exploring for people that are struggling with desire.
Absolutely. So first is, I think, looking at desire. What is desire, right? So we see desire on TV and movies as what we call spontaneous desire. You see somebody, you want to jump them, you want to have sex with them, you're really turned on, and it just goes, right? The desire's there. And it's this beautiful experience. That's great. That happens for some people. That happens for a lot of people. But then, particularly in long-term relationships, this sort of fizzles out. And it's not that the desire is gone. It's a different kind of desire. So it's now that when you're with your partner, you sort of don't have desire until you start being intimate together. So it's sort of like when you go to the gym, you don't want to go to the gym. When you get there, you're really happy you did. And so very similarly, when you're with your partner, when you used to be younger, there was some anticipation. You used to get dressed, you used to get ready for a date, you used to shave your legs, to do all these things because you're like, hey, sex might be on the table, we're going on a date. You had something to look forward to, right? But now your partner's there every night. You can turn around and have sex anytime you want. And so there's not this anticipation, this excitement. So there's two things there. One is that responsive desire, meaning the desire that comes when you're intimate with your partner, you're maybe touching each other, maybe you're naked, maybe you're next to each other, that comes after you begin initiating some sort of intimacy, is called responsive desire. And that's normal. That's completely normal. And knowing that can be really helpful, right? If I know that I have responsive desire, I may tell my partner, look, you can't just ask for sex. You need to be intimate with me. And then I will give you the signal and the okay, because I will then get turned on, I will get aroused, and then desire will come after. And so that's one. Two is that, just like I said, we used to go on dates. Now our dates are, let's go out for dinner, right? Most people, I would say not everyone's doing dinner dates, but most people, let's go out for dinner. And that's fine, but that's not intimate, right? It's let's go out for dinner, let's have a conversation, let's have a meal without our kids screaming at us, and have a glass of wine or whatever. And so that's fine. That's lovely in its own right, but it's certainly not setting you up for sex, right? You're bloated, you've had a little alcohol, you're just not necessarily going to want to have sex after having a big meal. And so, now scheduling time for what I call intimacy, right? Not where you're prioritizing dinner, you're prioritizing being together physically, right? And so that may be hey, we're going to lie together on our bed and we're going to be together and maybe talk about things that are intimate and be intimate with each other. And then if sex happens, great. If it doesn't, that's okay. It's a different kind of date, and this intimacy is really important. But it may then, one, get you excited about it. Two, it is setting up the stage for potential sex, and then potentially really good sex, because now you're hey, this is an important part of my life, and I really want to be there and be able to get in the mood, right? To set the mood. And it actually does make a difference. So in studies where they set the mood, people are more likely to have satisfying sex. And so I think those are things that you can easily do at home. And then also, as you mentioned, there's so much going on in life, right? You've got a lot going on. You have a lot of stress. And so if you can offload that in any way, shape, or form, whether that's your partner taking more responsibilities, maybe your older kids taking more responsibilities, maybe you're hiring people to do things, that then will allow you to have more brain space. And lastly, even doing some sort of mindfulness practice has been shown to help with desire. So if you meditate for 20 minutes a day, there was a study that showed, actually out of Canada, that showed that you will have an increase in all of the areas of your sexual index, basically, but also very significantly in desire. Because now when you're having sex, you're not thinking about, oh, I forgot to make cookies for the kids' bake sale or whatever. You're like, hey, I'm in the moment. I'm there. I'm present. I'm like, oh, that feels great. Like, I want to be there because that's where my brain is. It's not thinking about 100 other things.
Honestly, Rena, that's gold, right? Like I think so many of us are so busy. We need to kind of make things a priority, including that mindfulness practice, including offloading so many of our tasks so that we can be engaged. I think we know this, but it's great to hear from a specialist that sees this on a regular basis, because I have no doubts that this will make a difference for many folks. So what about, I hear a lot about, like, whether it's pain or dryness, whichever one was easier to address, especially in this perimenopausal population. What's the approach there?
Yeah, so if you're having pain or dryness, so one, during perimenopause, everyone's estrogen is going down. Now, perimenopause is a little bit of a roller coaster. So some days you may have high estrogen, some days you may have low estrogen. But generally speaking, the end product is that you're going to have low estrogen. And so that in and of itself will affect the vulvar tissues. So during this transition, you're going to see changes. You're going to have changes in the actual epithelium of the vagina. So it's going to become thinner. It's going to become more friable. There's less collagen content. And so that in and of itself will make potentially sex more uncomfortable. You'll also have less lubrication. You also notice that maybe the labia minora are starting to shrink and the urethra is starting to shrink, and the clitoris itself may even start becoming a little bit smaller. So all these things are happening that are largely hormonally driven. And so these can all contribute. Now, if you're having lack of lubrication and you're having pain with sex, the first thing is to increase that lubrication. So in terms of non-hormonal ways, you can use lubricant during sex. I think people underutilize this. I think lubricant is really fun and it makes sex more fun and enjoyable, more slippery. You can use water-based, which is the most common, but those will evaporate, so you're going to need to reapply. You can use silicone-based, which lasts a little bit longer. They're a bit more slippery. You don't need as much, and those are nice. You don't want to technically use them with your high-quality silicone-based sex toys, but I haven't really seen a problem in people who do use them, but that's the theory. And then lastly is oil-based. So coconut oil, any sort of oil-based lubricant will also last longer, but you don't want to use it if you're using condoms because it will degrade the condom. So that's one. Two is you can use moisturizers. So you can get over-the-counter moisturizers, which will moisturize the tissues. Just like you moisturize your skin, you're moisturizing the vaginal skin. And so they usually have hyaluronic acid and similar sort of factors in them that you then put, in the vagina. It lasts for a day to 3 days, depending on which one you buy. And then you just do it every day, like a routine. And then lastly, my personal favorite is vaginal estrogen of any formulation, because vaginal estrogen is going to correct the problem. Your receptors down there are now getting estrogen through this local application of estrogen. Now that can be through a cream, which you do in the vagina twice a week at night till death do you part, because it's always going to be lacking estrogen. You can use a suppository, or you can use a ring that's placed and left in for 3 months. Now, in terms of the concerns about systemic estrogen use, there is such a small amount of estrogen that goes into the bloodstream. It's extremely small. So it's very unlikely to cause any problems. There's never been a reported breast cancer, ovarian cancer, uterine cancer, any issue with vaginal estrogen, and it helped prevent UTI. So if you're having recurrent urinary tract infections, it is very effective in treating and preventing future UTIs. I mean, not treating in the short term, but treating the condition of recurrent UTIs. So it does take some time. So if you're struggling with UTIs and you start estrogen, it's not going to work right away. It takes about 6 weeks or so for the changes to occur in the epithelium to see the difference. But I would say it's very, very safe, very, very effective. and hopefully very affordable with things like good, coupons like GoodRx. Usually insurance covers it, cost plus drugs. I don't know if Canada has it, but in the US, you can log on to cost plus drugs and get a lot of medications, including vaginal estrogen, very, very affordably.
Amazing. I really like that point too about like, because without being an expert in it, I feel like the urinary tract infection risk probably goes up as we age, maybe related to this. And so like to kill two birds with one stone, I think is brilliant. I'm wondering, just out of curiosity then, like if you are a woman on HRT then, like you're taking systemic hormones, are you addressing that issue as well? Like are you reducing or improving your like your status, your vaginal, why can't I think of the word, like your labia is not as
Your
thin.
atrophy.
Excuse me, sorry. But yeah, are you
Okay.
improving things downstairs?
Yeah. So sometimes, usually you'll need both. So usually you'll need systemic hormones and then you'll need local hormones. So very often people are on both, and that's safe and fine and totally effective. So yes, usually you'll need both. And you could also be on vaginal estrogen without systemic hormone therapy if for whatever reason you're not a candidate. You don't need to take progesterone with vaginal estrogen. So it is again, a standalone. And the other thing it can sometimes help with is overactive bladder symptoms. So another thing people don't often know is if you're finding you're going to the bathroom a lot, or you have urge to go, or you're even waking up more than you used to, there is some data to support that vaginal estrogen will also improve these symptoms because there's estrogen receptors in the trigone, or the base of the bladder. So again, now we're killing three birds with one stone. So
I love it.
yeah.
I'm wondering too, this might be a tough question, Rena, but like as guys here, is there anything that we can be doing to support our partners during this time? Like honestly, like I think I'm doing a panel in November, and I think they're calling it Men of Menopause or something like that.
Oh, that's
And
so cute. I love that.
it's at Eudaimonia, and we're talking about like how we could support our partners, and it's more at a not necessarily sexual health perspective, but I do think there's an opportunity here talking to you that us guys can be more supportive. So does anything come to mind when it comes to us guys?
Yeah, I mean, so in fact, the interesting thing is a lot of the females in my practice come from their partners. So their
Oh, is
partners
that
will
right?
watch a video of mine and they'll send their partner to see me. And so that's one thing you can do. And I think, my patients have asked me, like, how do I bring this up with my partner? Because I really, like, I love her and I want her to be comfortable. And yes, I want her to have sex with me, but like, it's more than that, right? It's not just this base thing, but I think it's very tactical. Like you can't say to your partner, like, hey, I think you might be going through menopause. Your hormones are crazy. Like you need to see a doctor. Like that's not how you're going to approach your partner, right? But you can say like, look, I see that things are changing and I watched this piece of content or I listened to this podcast and, I found out that like, these are things that happen to women during menopause. Maybe you want to learn about this, right? So maybe even just sharing in that education can be helpful. So I think that will open the dialogue a little bit. Like say, hey, I saw this, I read this, I whatever it is, I listened to this, and like I think you'd really like it. I think it really helped me understand what you're going through, and maybe it'll help you with something too, right? So I think that's one. Two is, I think if you see that they're struggling and you have started the conversation before, like again, this is not going to be one conversation. It's going to come up over and over again. But I think always coming at it from a lens of like, I want to support you. I love you. I want you to feel better. I want you to feel like yourself again. And maybe go to the appointment with her, right? Like be there with her when she goes to see her doctor and realize like we said earlier, I mean, some of the doctors that you see are just not going to have the knowledge or expertise to tell you what to do. And they may tell you something that like so annoying or offensive. We've all been there, right? We've all been there where like we had an expectation of what our doctor was going to say to us. And they said something like, have a glass of wine and let it go, or just muscle through or whatever. And you're like, no, I'm here for help, right? And realize that like every doctor you see is doing the best with what they can. And oftentimes us doctors, we are really good at what we're good at. And then when we find something we're not good at, there are a lot of us who have a hard time saying, I don't know what to do with that, because that feels like we're a failure. So oftentimes we'll give some advice that we know, but like that's not the right advice. And so I don't think anyone's malicious in any intention, but I think that ultimately don't get discouraged. Maybe see someone else, do your research, find out in your area who may be someone you can see, or virtually if they're not in your area. But I think ultimately getting those sorts of things. And now there is, so many sort of online options that are, pretty good quality where you can see somebody who's an expert. So I think ultimately, support them, be there for them, help learn with them, educate with them, talk to them about sex, right? Like, I think this is the big issue in sexual health is like, no one taught us how to talk about sex.
Right.
We don't know how to talk about sex, right? Like, when is the last time you had a serious conversation about like, hey, what do you, are you still enjoying sex? Like bringing that question up is so loaded, right? Like, we don't want to know the answer if it's not, if they say no, right? But it's like, having conversations about like, hey, what could we do that's really fun? Or what turns you on that I do? Or what doesn't turn you on? And so like sort of getting an education from each other about what's good and what's not. And like having those conversations is just going to deepen your bond and also allow you to then optimize your sex life and show that you're really invested, right? In like them feeling good as well as yourself feeling good, but like as a couple feeling good and reconnecting.
Oh man, there's so many take homes here. It's like, it's really engagement, like being a true partner. And one of the things that you mentioned earlier that I personally really hung on to is like that intimacy aspect of like being there and not just going out for dinner and just taking that time to connect in a way that is meaningful. And I think it just all parties will benefit, obviously. And this is clearly not just for perimenopausal folk, but I just think it's a good lesson to hear that as a guy, like it's not all about us, what our desires are. It's what your partner's desires are, and really establishing that connection. I think is something anyway that I'm taking away, Rena. But
Yeah.
yeah, no, and but before jumping off, I just wanted to, I have to ask this question. Covering this topic, being on social media, it can't be it couldn't be easy. I'm wondering like how you landed here, and was it a struggle? Because I guess what I'm getting at in a long-winded way is that you're impacting so many people's lives in a positive way. You're empowering folks. I just heard this example of like guys hearing this content, bringing it to their partners, and lives are being changed that way. I'm real curious to how you got here, because it's like when we first connected 2-3 years ago, it feels like it was the beginning of the journey, but maybe it started before that.
Yeah, I mean, so I think really what happened was it was out of necessity. So I started making content because I was really interested in health literacy. That was like my passion. Like I wanted to do research in this area. I wanted to do all this stuff. And I realized like, if I do a research trial and I get a grant, it's going to take 5 years. And then I have to then disseminate that. And so why not start, I knew from the data already that video content or videos made a big difference in education. So I said, let's just start making videos about things that my patients like ask me, like they come to my clinic and I've literally counseled them on this 100 times. That's things they can do at home. Like they don't need to come to the doctor, wait in the waiting room, find parking, all that stuff. Like they can just watch this video. And so I started with that. And then as I made content and experimented with different things, I realized how desperate people were for sexual education. Like desperate, like they really wanted to know so many things. And I realized it was because sex education sucks, right? In our countries, it's not great. But then if you look at, other countries around the world, they get zero sexual education. So it's like there was this dearth of information, of high quality, evidence-based sexual medicine information online. And I was like, you know what? I'm just going to start doing it. And I just kept listening to my audience and making content around it. And because I was doing that, I was answering the questions that everyone had, right? Like I was answering the question that everyone had that they were too embarrassed to ask anybody. And so people then started feeling very comfortable, like, hey, I can watch this on my own time and I can learn about these things I've always wanted to know from a doctor who's an expert. And so I think that was sort of how it grew. And as you mentioned, it's changing lives around the world. And that's what really is so exciting about what it is. I realized like we can see, I mean, I was seeing at most when I was in Maryland, like 50, 40 patients a day, right? Which was like a really busy day. So yeah, 40 patients a day and then 30 to 40. But now I'm reaching millions of people every month, right? Like 6 to 8 million people a month watch my content. Another, you know, hundreds of thousands listen on my podcast, on my other social media platforms. And so we are, you know, because of that, it's just become this really passion project. Like you asked me, like, what do you think is, you know, the most interesting for the audience? And I said, I think that everyone cares about sex. Everyone loves to talk about it, or at least hear about it, because there's so much insecurity around it. And I think hopefully with my content and with this podcast, we can help people feel less insecure about their issues, about their concerns, and help them have better sex and ultimately better relationships, better work productivity. Like I think that the effects of improving someone's sex life are far reaching beyond just the microcosm of sex, right? Because when someone is struggling with sex, they're miserable, they're depressed, they're unhappy, they're less productive at work, they're less, you know, they're less engaged with their colleagues and their friends, and they're spending less time socially, and so when we fix that, we're now fixing all these things, and the people that they touch are affected positively because they're more positive. And so I think the reach of it is really important.
You nailed it, Rena. This is why I had you on. It's because like it might not be intuitive. We're talking about how we solve healthcare, how we improve the healthcare system. When you have people that are well, holistically well, especially we were talking a lot about the perimenopausal population that is vast. By the way, this is a huge segment of our population. You're more empowered, you're more willing to work, you're not leaving the workforce, your mental health is on point, you're more energetic. All these things fall into place that allow people to not just like survive but thrive. And I think especially post pandemic, I feel like a lot of people were lacking that like juice, they were lacking the jump. And your content, I gotta say, has been just so amazing to see. I told Rita this offline before, but I'm gonna say it right now. Like I'm just so proud. Like it's just been so amazing to see the rise. And Huberman, we're talking Mel Robbins, like all these people are catching wind because it's important, and it's because it's as we said, it's impacting people's lives, and it's just so beautiful to see. And I'm just really proud to be able to say that I know who you are, even, and it's really a privilege to have you on the show. I I would be remiss to say, like, where can people track you down, find your contact, listen to the podcast, let us know all the things.
Yeah, so I have a podcast as well, Rena Malik MD podcast. It's also available on YouTube, which is my largest platform. You can see all my video content as well as the videos of the podcast. I'm on all the platforms as Rena Malik MD, except for Facebook, which is Dr. Rena Malik. So you can find me wherever you normally are. And hopefully there's content there that will resonate with you, that will help you in your life. And would love to see you there.
I'm going to promise you, folks, you will find something that you're going to dive into, and constantly, like, where you're going to be clicking on several things. So thank you again for joining us on the show. This was amazing.
You're welcome. Thank you for having me.
Well, guys, Nation, welcome back. I hope everyone is luscious, because I'll tell you, this episode was proper. We got Dr. Rena Malik. Let me tell you, she is a urologist specialized in female pelvic medicine, reconstructive surgery, sexual medicine. And we're going to talk about sexual health, especially in the perimenopausal population. But in general, a lot of the topics that we talk about cover sexual health in general. And I'm just excited to talk to her because she's really been able to normalize it and reach the masses. She has an incredible YouTube channel with over 2 million subscribers. She's been on the Huberman podcast, Mel Robbins. She's been everywhere. And she's ascending. She's going to be a player, and when it comes to health and wellness space, I think. And it's been really awesome to see her rise because I connected with her 2 or 3 years ago through a mutual friend, Dr. Dwayne Hickling, and it's just incredible to see her growth. And as I mentioned, I just see great things for her moving forward. But so we'll jump into this episode, but before, let's hear a word from our sponsors. All right, without further ado, let's bring on Dr. Rena Malik. All right, folks, we'll be right back on Solving Healthcare Radio featuring Dr. Rena Malik. We are back on Solving Healthcare Radio featuring Dr. Rena Malik. Thanks so much for listening to Solving Healthcare Radio featuring our special guest, Dr. Rena Malik.